Whenever also you do your assessment, upon coming into the room, you will acknowledge your family, introduce yourself to them, let them know who you are and what's your purpose of you being there. Let them be included and ask any questions as necessary during your assessment. With the concerns of privacy for the patient, making sure that the door is closed and the curtains are pulled is always something that must be done, so that the patient, even though it is a baby, it's still important to maintain that privacy. Keeping the blinds closed as well, but opening the blinds when the assessment is completed, so that when you need to look at the monitor, you'll be able to see it through the window. And still, if you want to keep the door closed, you can. So coming in to do your baby's assessment, you first want to do some hand hygiene and put some gloves on. To do a patient identifier check, look for the baby's bracelets. They're usually on either leg or in the hand, or on both in this case. So you can identify that this is the baby that you're assessing, not only by the ID, but also on the ID band it'll state which room the baby's in, and this is the same room, room 17, room 17. After that, make sure that you have the bed on some heat so that the baby will get an additional heat source while you're doing the assessment, so the baby does not get cold. First you start with the head, and then you want to feel the fontanelles. It feels soft and flat. The sutures are nice and approximated. After that, you can come down to the eyes. See that she has nice white sclera and that there's no jaundice in the eyes. You can see that her nose looks nice and pink as well and patent. You can check and remove the nasal cannula, make sure there's no breakdown. After that, you can look in her mouth and see that her gums are nice and pink and her lips are too. After checking her mouth, making sure her mucous membranes are nice and moist and pink, then you want to try to slightly put a finger in her mouth, making sure that her palate is nice and intact. You will also want to look at the symmetry of her face in relation to her ears, her eyes, and where they are aligned, making sure that everything seems to be in appropriate alignment. Also looking at her ears, making sure they are well formed, the cartilage is nice and firm or soft, depending upon her gestational age, and for her gestational age at 34 weeks, they seem to be formed appropriately. Once you go from there, you can check her pulses, her brachial pulses on both sides. It's nice and strong, and nice and strong there as well. You can also check for her capillary refill this time on her extremities and then centrally. A nice in 2 to 3 seconds cap refill. Once you've done that, we want to take a temperature before she gets too chilly from the being unwrapped. So you can take a temperature, just axillary temp, underneath her arm and hold it there until it registers on your thermometer. And you can take that off and remove it. Making sure that you have all your supplies ready and close to you at the bedside is always a really nice thing to be able to have. It gives you good organizational skills, and it gets you time management skills. You can put her hat on after you're done with her head assessment. That way you don't have to worry about her head getting cool or chilly. Once you're done with the temperature, we can then listen to her heart and her lungs. Listening to her heart, seeing what her heart rate is. Usually the first assessment of the night, you can check it with the clock to see how well it correlates with the monitor. You also want to listen for her breath sounds. The front, both sides, and down just a little bit, since babies don't have much space for their lungs. You also want to listen to her bowel sounds. And then just over in both areas. Upper right quadrant and lower right quadrant. and upper left quadrant and lower left quadrant. Those sound very good. Once done listening to her heart sounds, her lungs, and her abdomen, then you can assess and see if she's having a tachypnea or retractions, or if there's any asymmetric looking appearance to her chest. Then after that, you can come down to the abdomen, make sure that it is nice and soft, that it's not distended, it's round, there are no loops that you feel upon palpation, and again, the umbilicus area to check to see the appearance of that. Once that is completed, you can finish going down through your head-to-toe assessment so she doesn't get too anxious or wound up. You can also do her blood pressure, and we usually do it on the legs. So you always want to get a blood pressure cuff that matches the circumference of her calf. And on the blood pressure cuff itself, it has the markings on here of the calf circumference. If you get one that's too small or too big, you'll get an incorrect reading. And then you can just get that pressure. And then while this is going, if she seems to be getting upset at that time, you can always offer a pacifier. And then with the pacifier, you can also offer some Sweeties. And Sweeties is a pain solution not a pain solution, but a sucrose solution that we use for pain in the neonatal ICU that helps to decrease pain. It's absorbed in the mucous membranes in her gums and acts on the pain receptors so that she doesn't feel as much pain. So you can offer that to her at any time during the assessment if it seems like it's going to be uncomfortable to her. Now you could also get her respirations while she's calmed down with the Sweeties. So you can count those out manually and then also see how they correlate to the monitor. You can see that she has her leads on for the monitor. She also has a pulse ox on her foot, and that monitors her oxygenation in her blood. And then each assessment we always change that to the opposite extremity. If she has an IV in her other foot, then we will put it on her wrist. And then while we're here doing her assessment, we can check to see her the patency of her IV that she has here for her antibiotics. So with that, we'll just do a little flush. It's always good to do that now while she's being assessed rather than waking her up before her antibiotics are due. So we can just get that done right now and see how well that flushes. Flushes good. Don't see any redness or puffiness or anything there at the IV insertion site. So our baby has umbilitis, and that is why she has antibiotics. So we really need to check her belly area. We need to check around the umbilicus and to make sure that the redness that's around her umbilicus has not gotten any worse. Make sure that there's no oozing or anything like that coming from around the umbilicus area. We then can check her femoral pulses at this time. Check those, and those are good as well. So then we go ahead and then we can change her diaper. And while we change her diaper, we can check to see to make sure that everything looks appropriate for her age and gestation. See if she has stooled or given us some good urine output. Keep those prongs in. She also has her thermometer probe here on so that the bed can give her some heat if needed. It's over here on her right side. Umbilicus is nice and showing. After her diaper is changed, you do need to look at the diaper if there's stool in there to see the consistency, the color, make sure there's no blood in the stool, make sure that the urine in the diaper looks nice light pale yellow, and that everything is within normal limits. Let me change my gloves since I changed the diaper. Wash my hands. And a pair of clean gloves. Let's fix her nasal cannula that keeps coming out of her nose. There we go. Once her diaper is changed, we can then continue with looking at her legs, not only just her tone of her legs, but also making sure they're nice and warm. Her toes are nice and pink and warm, and that she has good reflexes with each foot. We can also see if she has a good reflex with her grasp, and then we've already assessed her good suck reflex with the pacifier. Then we want to turn her over just a little bit, check her back, make sure that there's no breakdown, and that her skin is nice and warm and dry and pink with a good cap refill as well. Throughout the assessment, we can check for her tone, and seeing that her tone has been maintained the whole time, it's appropriate for her gestational age. She has good range of motion. She moves her legs really well, her arms really well. She even can turn her neck when she wants to. She has a good cry when she does cry. And overall assessment, minus her umbilitis on her umbilical area, is very good. The 34-week neonate still needs to maintain a little bit of heat for herself. So now I'm going to wrap her up. We'll keep that IV site out so that we can monitor it. Now the other thing that we need to make sure is that in her bed that she has the appropriate things that are needed in case of some type of emergency situation. The one thing that we want to always make sure is there's a bulb syringe in the bed, so that if she spits up at all, that we can get that and clear her airway as quickly as possible. The other thing that's located near her bed, around the bed area for safety. Over here we have her oxygen mask, which we can give her oxygen with a bag as well, so that she can have increased pressure and we can breathe for her if necessary. And also here on the wall we have the oxygen that's delivering through her nasal cannula, and we always need to make sure with each assessment, especially at the beginning of the shift, to make sure that it is on the number that was actually given to us in report. And then throughout the night check on it, because sometimes they drift in their numbers. Also, we have the suction canister right here that's set up if we need to suction her more than what the bulb syringe can actually handle. So we have the bag and mask for safety, and we have the suction also for safety. Additional safety concerns that need to be addressed with the patient in the neonatal ICU is to make sure that the bed is locked, the brakes are on, so that we don't have to worry about the bed being moved at all. Also that the portholes are closed and secured, and the bedside is up and locked. Make sure that this is all the way around the bed, that we have locked brakes, portholes closed and secure, and doors are up and secure as well. The monitor is another tool that we use to make sure that the baby is having appropriate limits within its heart rate, its respiratory rate, and its oxygenation. Also, for security in the neonatal ICU, it's a locked facility, so nobody can come in or come out without being addressed. Once you're completed with the assessment, you can take your gloves off now, perform some hand hygiene, and then either turn off the lights or dim the lights. If the parents are here, you can just dim the lights for them and for the baby, and then close the door or curtain for additional privacy for them.